I get a lot of questions from my website, and Barbara's with me to take me through those. So what's the first question, Barbara?
Okay, Dr. Sibthorpe. Our first question is from Justin. I'm 36 years old and my right cheek wrinkles when I smile and my face looks old and sunken. I even try to avoid smiling because of this. What's the best solution to give my cheek some volume and make it look rounder and have more impact? He sent us a picture.
All right. Okay. So what I can see from the picture is Justin has lost some fat from the mid-cheek, and he's got these fracture lines or folds, particularly when he smiles. And he looks like he's, what was his age, 36? He looks like a youngish guy.
36.
Yeah. I don't know if he's been doing a lot of gym workout. You tend to lose fat in the face if you do a lot of exercise, particularly aerobic. And they call it a gym face. But one of the ways to treat this is to, as we get older or we lose fat from the face, our faces tend to collapse laterally and vertically. And so one of the ways to sort this out is to actually expand our faces laterally. So we're looking to really do this, and we're using fillers in this area to expand it laterally. Now, what you often find is you have laxity of the skin around this area. So we use a combination product, which is a filler and a stimulator, and it's designed specifically for skin laxity. And I'm looking at the photograph, and it tells me there's quite a bit of skin laxity that Justin has. What we've got to be careful is not to feminize the face. Typically, approach for treating a lady would be to use fillers along the zygomatic arch or the cheek arch, and to lift. We want to do some of that lifting, but we do not want to give them a cheek. So we use less in a man. We tend to use them a little bit more centrally with using fillers, but we're using small amounts, again, strategic points. And in fact, in Justin's case, we may even have to address some of the deep fat compartments and put a little bit of filler into that area as well. That would be, the way to start approaching it anyway.
Well, that's good advice. Andrew is 44 years old and wants to know how to fix hollow eyes due to lack of fat pads and thin skin. We get a lot of questions that.
Yeah, and it's what we call tear troughs, really. So as we get older, we develop these tear troughs. I have them myself. It's easy for a practitioner to think, okay, we'll put some filler in there. You really do have to assess and see whether they're suitable for having filler in there, because if the skin is very crepey, like myself, you can't actually have too much filler there because the drainage aspect may be poor, and therefore I may end up with puffiness, particularly from the fillers that are placed there. If they are more hollow and the skin is more elastic, then they're a good candidate for what we call a tear trough filler treatment. And we're using, again, small amounts of filler just to place along the bone deep, and to give us some elevation and resolve that volume. What was the other aspect of the question? Was there another?
He doesn't feel like he has fat pads and he feels his skin is thin.
Yeah.
He's 44.
So again, the skin is very thin here, so we are very mindful of that, and we're using fillers that are a little bit more kinder. They're not as thick. They're thinner fillers generally because of that thin skin. So we'll proceed carefully with the tear trough treatment.
And go to a really reliable practitioner.
It's an advanced procedure. Shouldn't really be carried out by anyone that hasn't had some experience and hasn't been doing some aesthetic treatments for some years, I would say. Not the sort of thing you start off doing.
Okay, our next question is from Bella. Bella's 44 years old and wants to know if Botox is safe to use for crow's feet, hooded eyes, and frown lines. One brow is lower than the other. She really wants to get Botox for her frown line and crow's feet, but she's afraid it's going to make her brow droop even more. She saw a plastic surgeon who said she's not a candidate for forehead Botox because it can make drooping worse and that she should have a brow lift. She's not quite ready for a brow lift. She's fine with not getting Botox on her forehead, but are the other areas safe?
Okay, so I see quite a few of these type of patients where, again, we're treating the frowns. This is the number one area, really, this area here, the tram lines they call them. And we're treating it not so much for the wrinkles or the angry look that you may have, but to elevate the brow. As we get older, the brow tends to drop. So this is a good treatment to reverse that and give some elevation. If we've got a forehead also with wrinkles and furrows across it, these are what we call the elevators. And if you put Botox in here and you put too much, you can actually cause a brow drop. Also, if someone has a very narrow forehead, it's not a good idea to use Botox there. It's probably better to leave it alone. If you have a fringe or you have long hair, you don't necessarily see it and need it anyway. With regards to the crow's feet, well, that's a typically common treatment for the ladies, not so much in the men, but certainly for the ladies. And we are treating around this lateral aspect. We avoid going in too far into this area to chase the wrinkle, because typically what will happen is the wrinkle will then bunch up here, or even worse is that you will weaken the muscle tone here and the fat will protrude and cause an eye bag. The other little trick that we do is around this area. So if someone has a hooding or a lid hooding, we can do a Botox treatment here that will give some elevation. And again, you've got to be very knowledgeable where you give that injection, because if you hit the frontalis muscle, you'll get the opposite and you're going to drop. So you have to know that you're hitting a particular muscle, the orbicularis oculi, which will give us the elevation. So I would say that she's, overall, from the sounds of it, she would be fine to have injections for the frowns here and the eyes, and possibly on assessment, depending on the strength of that muscle, the orbicularis oculi, as to whether we actually give her a little bit of lateral brow elevation as well.
I'd like you to encourage people to really do their homework and really find practitioners who are qualified, because during this whole session you were talking a lot about the anatomy of the face. Yeah. You're pointing out various muscles and various veins and whatever. You really have to go to a doctor who knows what he's doing. Can you impress that on
Yes, I think that
the people who are asking us questions?
I think the more we understand about the treatments that we're doing, the more we need to have knowledge and experience, because we're starting to see problems with Botox. We're starting to see problems particularly with fillers. And so you've got to be very careful about where you use them and when it's appropriate to use them. You've got to understand the anatomy to, again, be able to do the right treatment and right technique, putting the right type of filler at the right depth. And as I've always said, I've had this less is more approach, and I think this is even more so as we move forward. I think a lot of the experienced practitioners realize the same thing. We do small amounts and we do less. We can get good results by doing that. The fillers themselves actually do last longer than we initially thought or were told. And when you've had several treatments, we're finding that's particularly the case. So I think it's very important, and when I talked about the tear trough, and there are certain areas of the face where the anatomy is more intricate or delicate, these are more advanced aesthetic procedures, and so you really do need to search out and find someone that has that experience. It's not someone that's gone on a day course or been doing it a year or so. It's someone who's been doing it 5 years or 6 or 10 years, that are doing some of these advanced treatments. And it's someone that's also passionate about doing the aesthetics, in that they are keeping up to date, in that they are understanding the detail with the anatomy and the products and the procedures and the techniques that they're using. A lot of us, we belong to organizations. We are obviously medically registered with the General Medical Council, or we're belong to organisations such as the British College of Aesthetic Medicine. And we usually attend a lot of conferences, and we discuss cases between colleagues. And I think this is where, over time you realise that, the knowledge and the experience is paramount. So I would say to any patient, any person that's looking to have these procedures, do your homework, do your research, and don't in a rush to proceed to treatments. I think if necessary, go and see more than one practitioner.
And look at credentials.
Look at credentials, look at some of their before and after photographs, ask them lots of questions. Don't necessarily feel obliged to proceed with the treatment on the day. I've heard that so many times from patients where they felt obliged to proceed with the treatment on the day. There should be what we call a cooling off period, so that the patient can go away and think about what's been said and then make a decision about what treatment is suitable or not.
Excellent advice. Well, we don't have any more questions.
We run out of questions.
That was excellent.
If we've got any more questions, please go to my website and submit them there. Thank you.